Hello and welcome. Today we're diving deep into the world of ophthalmology to understand a fascinating and sometimes visually dramatic eye disease known as Best disease or Vitelliform Macular Dystrophy. Join us as we explore its origins, symptoms, diagnosis, and what the future holds for those affected by this condition. So, what causes Best disease? It's primarily a genetic condition, meaning it's usually passed down from parents to their children. The most common culprit is a mutation in the BEST1 gene, which provides instructions for making a protein called bestrophin 1. While less frequent, mutations in other genes may also be responsible. It's crucial to understand that having the gene doesn't guarantee you'll develop the disease, but it significantly increases your risk. Now, let's unravel the pathophysiology. Think of your retina as the film in a camera, and the macula as the central part that gives you sharp, detailed vision. In Best disease, the mutated bestrophin 1 protein disrupts the normal function of the retinal pigment epithelium, or RPE. The RPE is a layer of cells that nourishes the photoreceptors in the retina and clears out waste products. When the RPE malfunctions, a yellowish, egg yolk-like material, called lipofuscin, accumulates between the RPE and the photoreceptors in the macula. This buildup distorts and eventually damages the photoreceptors, leading to vision loss. When we look at who's affected, Best disease is relatively rare. It typically appears in childhood or adolescence, although in some cases, it can manifest later in life. Because it's genetic, individuals with a family history of the disease are at a higher risk. It affects both males and females equally, and there's no known predisposition based on ethnicity or geographic location. What are the telltale signs and symptoms? In the early stages, many people with Best disease experience no noticeable vision problems at all. As the disease progresses, symptoms may include blurred or distorted central vision, difficulty reading, and problems with color perception. Some individuals may experience metamorphopsia, where straight lines appear wavy. Importantly, peripheral vision is typically unaffected, which helps distinguish it from other macular degenerations. How is Best disease diagnosed? An ophthalmologist will conduct a comprehensive eye exam, including visual acuity testing and a dilated fundus examination to visualize the retina. Optical coherence tomography, or OCT, is used to image the layers of the retina and reveal the characteristic lipofuscin deposit. Electrooculography, or EO, measures the electrical activity of the RPE and is often abnormal in Best disease. Even in early stages when vision is good, genetic testing can confirm the diagnosis by identifying mutations in the BEST1 gene. Best disease doesn't necessarily fall into strict categories, but its progression is often described through stages. The vitelliform stage is characterized by the classic egg yolk appearance. The pseudohypopian stage is when the eye yolk starts to break up. The vital eruptive stage sees further disintegration of the deposit. Finally, the atrophic stage involves significant RPE and photoreceptor damage, leading to more pronounced vision loss. These stages don't always occur linearly, and some individuals may remain in a stable vitelliform stage for many years. Unfortunately, there's currently no cure for Best disease. Treatment focuses on managing complications and maximizing remaining vision. Low vision aids, such as magnifying glasses and specialized lighting, can help individuals cope with vision loss. In some cases, choroidal neovascularization, where abnormal blood vessels grow beneath the retina, can develop. This complication may be treated with anti-VEGF injections to prevent further vision loss. It's essential to work closely with an ophthalmologist and a low vision specialist to develop a personalized management plan. Since Best disease is a genetic condition, there's no known way to prevent it. However, genetic counseling can be beneficial for families with a history of the disease. Counseling can provide information about the risks of passing on the gene to future generations and available options, such as preimplantation genetic diagnosis. The prognosis for Best disease is variable. While some individuals experience mild vision loss over their lifetime, others may develop more significant visual impairment. Regular monitoring by an ophthalmologist is crucial to detect and manage complications. Research is ongoing to develop new therapies that could potentially slow or halt the progression of the disease. Promising avenues include gene therapy, which aims to replace or repair the faulty BEST1 gene. Scientists are also exploring ways to protect the RPE and photoreceptors from further damage. These advances offer hope for improved outcomes for individuals with Best disease in the future. Thank you for joining us on this exploration of Best disease.